With us today are two key members of the technology community who are going to help us make sense out of all of this. We have Nick Castellina, who's Senior Research Analyst for the Business Planning and Execution Practice of Aberdeen Group. Also with us today is the CEO and founder of Apparancy, Karen Watts. We look forward to hearing from them.
Thanks, Judith, and welcome today, Karen.
Thank you, Nick.
Let's get to the heart of our discussion today, business process management and the new healthcare law compliance. At Aberdeen, we define six categories of business process management, and those are workflow management, business process execution, exception management, business process modeling, business process optimization and control, and then lastly, business activity monitoring tools. And as you can see from a lot of the research we've done, the best-in-class organizations are much more likely to have implemented these tools across their organization at a significantly higher rate. For example, you see one point here that the best-in-class are 93% more likely than all others to have business process execution. But unfortunately, not all organizations are lucky enough to have all of these key criteria. Where does Apparancy fit into this model? Does it address all of these criteria? Who are you targeting, and what can the solution do?
Yes, Nick, we actually do all of those things. While Apparancy is an end-to-end solution, it's important to understand that the technology underneath Apparancy and the advantages we provide to our customer are actually from our sister company, Corfino, which was founded 5 years ago. When we founded Corfino, we figured out two major market requirements ahead of the market. The first one was that cloud deployment was going to change everything, and that SaaS installation and payment models were going to provide huge time, resource, and cost advantages to organizations. Second thing was related to the heartbeat of Corfino, which was that the financial compliancy and ensuring that companies were audit ready with vetted workflows that correctly and intelligently compiled data from a wide variety of enterprise systems, whether those systems were ERP systems, payroll systems, or vertical application systems, basically any data feed. While Corfino was a turnkey solution for CFOs, we decided that if we could nail down compliancy in the financial market, then we could do it anywhere. And of course, as you said on your slide, companies have to have all six of those things to be successful. So that said, with Apparancy, we are taking that technology and moving beyond the finance vertical to support other areas of compliances, especially in the healthcare industry, and our first solutions are going to be targeted at the Affordable Health Care Act.
You know, it's interesting that you mentioned compliance. That's something that we're seeing more and more as a big issue in healthcare. One of the surveys that I do every year is our Aberdeen Business Review, which I just completed this past summer. And what we found is the top challenge that healthcare organizations are facing, 47% reported this challenge, were changing regulatory requirements. So again, that's something that's really affecting healthcare organizations. Another thing that's really affecting healthcare organizations is big data, the term big data. You've probably seen a lot of reports in the media around how big data is affecting healthcare organizations. What we're finding is that 20% of healthcare organizations are reporting an increase in the complexity and the amount and the velocity of their data. And what we're seeing is that 86% state that big data is going to affect their software selection and their software strategies going forward. How does Apparancy fit into this model? Is big data something that you care about, and is something that you've addressed within the solution?
Yeah, absolutely. We care about all data, whether it's data coming from internal sources or constituents, or data coming from the large number and growing number of disparate systems out there, in addition to both social applications and mobile applications. You know, when the ERP companies were founded, decades and decades ago, they were kind of the tool that companies used to manage data. There was, finance tools, or finance reports, legal reports, regulatory reports. There was predefined workflows in those systems that would, guarantee the stuff got done, and then there was tools to measure that. Now the business environment has changed. Technology has forced that. You've got there's not these, everything's not in one system anymore. The data is coming in, as you said, from multiple locations. It's coming in unstructured, it's coming in from mobile, it can be a chat, it can even be a text now. And so now you've got a mass amount of unstructured data coming in. So that is actually one of our areas of specialties. Even though we're not really a database company or an analytics company, we have the ability to gather all of that information regardless of where it's coming from, display it or position it or give it to you in a format that you can use to make the decisions that you need to use, and then be able to execute your business. We do that by providing purpose and workflow solutions that allow companies not only to manage and process and execute the things they need to do with the data, but also to keep on top of regulatory changes. As I mentioned earlier, the Affordable Health Care Act is a good example of that.
Now, you mentioned the importance of having a solution that's easily flexible and can easily support business change. These regulations aren't going to stop. There's going to be more of them. They're going to be different than the regulations that healthcare organizations are forced to adhere to now. So I think within technology that needs to be addressed. One of the things we're seeing is that best-in-class organizations are really more likely to have a solution that's easily tailored to business change. For example, 45% of the best-in-class can dynamically update business processes as best practices emerge and new regulations emerge, in comparison to only 25% of all others. Even more importantly, the best-in-class organizations are over twice as likely as all others to be able to quickly tailor their business solutions to support the business change. Again, having this flexible solution is really going to enable healthcare organizations to be prepared for any changes that come after them in the future. Now, are we talking about Apparancy solving business process requirements for healthcare providers specifically? Who are you targeting? Is it insurers, payers? Is it organizations that are trying to get their workforce practices in compliance? Who is your target?
Well, the answer is all of the above, but let me give you a little bit more detail on that. As you know, with the Affordable Health Care Act, every single U.S. company is affected by it, whether you're small, whether you're large, whether you're private, whether you're public. Doesn't matter what industry you're in. You are going to have to do something. The list of somethings varies by what size company you are, and you're going to have to prove that you did that. So our very first mission is going to be to provide a solution set to those companies to help them manage the process which they've already begun, which is enrolling and offering the right plans, but also being able to report the fact that they did that and report the information that needs to be reported to the various regulatory agencies that are asking for this information. Then we're going to move our solutions onto the healthcare world, and the healthcare companies have a problem. Maybe, I'm not going to say whether it's big or small, but they have a large problem too. Historically, they got paid based on, test run or surgery performed or Band-Aid distributed. We've all heard the joke about getting charged $12 for a Band-Aid, but that's changing now. And now they're being forced, now they're going to get paid on outcomes. Well, these organizations have no ability, much less, they can barely handle how to bill for a Band-Aid or a surgery or an MRI, much less how to bill out and manage an outcome of a patient. So it's not, did I do the surgery? It's, did this surgery actually cure this patient? And they have no choice. They have to do that. If they don't do that, they're not getting paid. So our second set of solutions is going to be, again, very similar like we've done in the finance space, is aggregate information from all the disparate things, whether it's, the electronic health records, whether it's government, whether it's benchmarks, all these types of things, social, talking to the patients, asking them how they feel, getting all that data, aggregating that up, and then letting them, one, be able to bill for the outcome, and then two, most importantly, get paid for that.
It's very interesting, and there's a lot for healthcare organizations to think about today. Fortunately, there is help, but I don't think they should forget about the key requirements of a business process management strategy that have been true for years and years now. What we would recommend is for organizations to implement solutions that are functional, flexible, and modern. Do not ignore the basics of BPM technology. You'll note that organizations with a functional BPM report a 9% improvement or decrease in the cycle time of key business processes over the past 12 months. And we can see all sorts of statistics that are similar to that about the key improvements that can come from a BPM solution. This is accomplished through things like business process rules engines, best practices templates, real-time visibility into the status of all processes. These are things that organizations should have within their tools, but they should also be looking for a modern tool that can support big data and has social and cloud capabilities. Some of the research we have indicates that best-in-class organizations are twice as likely as all others to have implemented mobile BPM, and they're 32% currently have a social BPM strategy. And we've already discussed the importance of having a flexible solution, which you guys appear to be addressing. With that said, thanks for your time, Karen. And for the people that are listening in today, if you would like more information on this topic, please visit Aberdeen.com or visit Apparancy.com. Thank you.
Thank you.